Hello and welcome to PCOM Perspectives. I'm your host, Dr. Jay Feldstein, and today we're talking with Dr. Mandy Reece about interprofessional education. Dr. Reece is the Vice Chair and Associate Professor of the Department of Pharmacy Practice at the PCOM School of Pharmacy in Georgia. In addition, she is Director of Interprofessional Education at the Georgia campus. Dr. Reece earned a Doctor of Pharmacy degree from Mercer University College of Pharmacy in Atlanta. She completed a postgraduate Year 1 community pharmacy residency, also from Mercer. During her tenure at PCOM, she has coordinated and taught many courses within the School of Pharmacy. Her passion for diabetes and caring for patients with diabetes has led to a clinical and research specialty of endocrinology with a focus on diabetes. In 2015, Dr. Reece was elected to a 3-year term on the American Association of Diabetes Educators Board of Directors. She is the incoming treasurer of the AADE, in which she was inducted as a fellow in 2017. Welcome, Dr. Reece. Could you tell us how the IPE story began at Georgia PCOM?
Sure, I would love to. It actually began back in 2012. Dr. Buxton and Dimeling, Gregory, and Poole actually went to a conference, an IPEC conference, and from there developed a IPE committee here on the Georgia campus. In spring of 2013, the first IPV event was held with DO and PharmD students. They were given a patient case, and they were given the case initially separate. They reviewed it, then they came together as a team to talk about the case. Then about 3 weeks later, they met again on that same patient, but between that first and the second meeting, they were given changes that the patient experienced, including a hospitalization and a discharge. And then at that second meeting, they worked together in solving the patient case.
How has the IPE curriculum grown over the last several years at Georgia PCOM?
We actually grew from that initial 2013 session to in 2014, we used a virtual standard patient using Blackboard Collaborate. The students worked together in groups and having a virtual meeting with the patient, and they developed a SOAP note and were given a faculty advisor to debrief with the groups. In 2015, we grew to where we had IPE events during the fall and winter terms for the second year medical and pharmacy students as a formalized course. We utilized technology tools, group assignments in that, and we incorporated a new theme on addiction. We had a speaker, an author come and talk about addiction and the realities of addictions, and the students completed 3 online collaborative sessions about addiction in that book. And then in the fall of 2016, and that was an exciting time, we created a year-long IPE course for first-year DO and pharmacy students. We incorporated topics such as the role of the healthcare professionals and their role in the team, teamwork in the life of a real patient, leadership, professionalism, cultural and religious competencies, opioid addiction, and medical errors. And the students were assigned to work in groups in this year-long course. And we have continued that INDP 100 course, and we now includes first-year PA and first-year PT students. New this year, and this has been really exciting, is the INDP 200 course, which is a year-long course for second-year DO and second-year pharmacy students, where they have a simulation activity in fall and winter terms in the simulation center, and they work together to diagnose and treat a patient. They have a debriefing session on how they've worked together as a team. And then lastly, in the fall of 2018, we created a new IPE case-based activity for third-year DO and fourth-year pharmacy students.
So what have been some of the key ingredients for the success of the year-long IPE course for all first-year DO, PA, PharmD, and PT students?
Having a committed group of core faculty to ensure the vision for IPE has been a vital key. Additionally, the support of administration from all programs on the Georgia campus, as well as having faculty committed to the development of these courses and ensuring that they happen. I'd like to give a special thanks to Dr. Adunam and Buxton, as they have been vital leaders for IPE on Georgia campus.
So how has the IPE curriculum success for Georgia PCOM been shared?
Oh, this has been another exciting area. We have actually presented at the ACOM meetings, the annual meetings from 2015 to 2017, sharing our story with other osteopathic medical schools and what we've done with our IPE along the way.
What are the next steps for IPE at Georgia PCOM?
We want to begin to integrate nursing students into our IPE courses and collaborate with other health profession programs within the Gwinnett, Greater Atlanta area. Also, the creation of an official INDP 300 course for third-year medical and pharmacy students.
Well, that's really exciting. It sounds like you've done a great job with IPE in Georgia PCOM. Are there any questions that you have for me?
I have a few questions for you. The first question, how do you measure the success of IPE integration into the curriculum across all PCOM campuses?
That's funny, Mandy, because I was going to ask you that question, but since you asked me instead, I think there's a couple of ways that we'll measure the success. One is I think we truly have to survey and measure student satisfaction with the experience. We need to do that at all levels of all courses. What's their baseline comfort level in working with other healthcare professionals as part of a healthcare team. But I think ultimately the measure of success is how successful they are when they enter the marketplace as practicing healthcare professionals. And, in this value-based world, when they really have a leg up in functioning as part of a healthcare team in their professional environment, it will be because of the training that they had at PCOM.
I could not agree with you more. The next question I have for you is, how do you see IPE fitting into the larger healthcare ecosystem, especially in terms of value-based healthcare and population health?
Yeah, I think we touched on it in your first question. That is, healthcare is a team event. It's a team effort. You're going to have more and more healthcare teams making up of healthcare professionals, physicians, nurses, physician's assistants, pharmacists, social worker, or mental health care counselors, all working together for the individual patient's needs and for addressing, population's needs in terms of healthcare disparities and social issues to really improve health outcomes. And in terms of value, it's, what's the cost of services for the healthcare outcome desired? And when we start to see better adherence to medication, when we start to see more successful preventive interventions in terms of preventing type 2 diabetes, more behavior modification and behavior change in overall healthcare, that's when we're really going to see the impact on healthcare outcomes and healthcare costs. And that's where IPE really comes into play, because if people are comfortable learning together in their pre-professional stages, they're going to be more comfortable working together in their professional environment.
Yep, so very true. And I see that as a diabetes educator and as a new faculty member on a family medicine GME program. The last question I have for you is, what do you see as the greatest challenge to achieving full integration of IPE within PCOM?
I think not only so much as the challenge at PCOM, but I think for interprofessional education everywhere across all professions is ideally we'd like to have individuals in the same classroom at the same time. I know because of the accreditation requirements on lecture and didactic experiential education, we have to do a lot of our RPE after traditional hours. And I think to get the programs truly integrated, people need to be sitting side by side in classrooms during regular classroom hours. Maybe someday we can get to that, but to me, that's the ultimate challenge.
Well, we've got a great vision to work towards.
Well, I just want to thank you, Dr. Reece. As we emphasize interprofessional education at PCOM, I'm pleased to highlight the great job our faculty are doing in integrating IPE across all campuses. To listen to past episodes of this podcast and to become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.